studies show vaccine protection does fade over time.
Yeah, Dr. Anthony Fauci says a booster may not be needed on a regular basis, but CDC Director Rochelle Walensky said that's still up in the air. Here's what she told Savannah Guthrie on the Today Show just earlier.
I don't think we know that right now. What I will say is there's numerous vaccines where we have 2 primes of a series and then a later booster, and we don't need a boost after that. The hepatitis B vaccine would be one example. So I think we still obviously need to continue to follow the science. We need to see what happens with further variants and whether we have further variants here. But right now we're taking this one step at a time. We know we need a boost now, and we will continue to follow the science. But I don't think it's a given that we will be doing this, continuously.
Joining us now is Dr. David Priest. He oversees infectious diseases at Novant Health, which has more than a dozen hospitals across North Carolina.
Dr. Priest, good to have you with us. We're going to talk about the situation where you are in a moment. But first, we want to ask you about those booster shots. What do they do for our immunity? Do you think regular booster shots are something that might be here to stay?
Yeah, so this third dose, and I almost don't even refer to it as a booster, as our CDC director just said, it's really the third dose in a primary series. What those doses do is really raise the level of antibody and immune response into someone who's had it. So I think what CDC has seen in the data is over time that immunity can wane, and they want to get ahead of that. So before we see a lot of vaccinated individuals in the hospital or vaccinated individuals dying of COVID, let's go ahead and move and give that third dose. The good news is right now, if you've been vaccinated in the United States, you have a less than 1% chance of being admitted to the hospital or dying of COVID. So this is a proactive response from CDC and our public health infrastructure.
Now, you're in North Carolina, as we mentioned, and like much of the country, cases are rising there because of the Delta variant. So tell us how things are going. What are you seeing in your hospitals right now?
Yeah, so as you mentioned, we have a lot of hospitals across North Carolina, and what we're seeing is really a 15-fold increase in the number of individuals in the hospital. 91% of those individuals are unvaccinated. If you look at the 9 or 10% that are vaccinated admitted to the hospital, their average age is 77 years old. They often have other healthcare problems. And to the CDC director's point, they were vaccinated very early in the pandemic. And what that tells us is those are individuals who would most likely benefit from this third dose of vaccine. So it's still really a disease of the unvaccinated. It's moving through our communities of unvaccinated individuals, and then it's spilling over onto the vulnerable vaccinated. Right now, 97% of our ICU beds are full. And so we're kind of where we were in January and February again.
I mean, your hospital, like most, has been battling this for a year and a half now. How's your staff doing and holding up? I mean, I have to assume you're in a position you just didn't think you'd be in right now with all the vaccines available.
Yeah, absolutely. And those same healthcare heroes that we've celebrated for so many months, they're tired. And we often have the infrastructure and the bed capacity to deal with the volume of patients, but we have to have the staff, right? So if you have staff that just need a break and have to stop, we have to bring in travelers from other parts of the country to help manage the volume. And they're tired. And one of the frustrating things is they think, here's an individual in front of me and this who has COVID, and it could have been prevented by vaccination or taking the precautions necessary to avoid it. But in healthcare, we have a long tradition of caring for individuals who may have health problems that are the result of human behavior. So they continue to respond and are performing really, really well. But we just encourage people to get vaccinated so that we can, relieve those folks who are caring for the sick.
Doctor, you say you're at 97% capacity right now, similar to what it was at the beginning of the year. But at least back then, there were more mitigation things going on with masks and social distancing. Now it's a different story. How worried are you about the next few weeks? Could this be even worse than what you saw earlier this year?
Yeah, we're definitely concerned. And one of the concerns is that, early on, that first COVID alpha variant that we saw, and when someone got infected with that, they might infect 2 or 3 people around them. With the Delta variant, it's much more contagious. So if you get infected, you may infect 5 to 10 people around you. So it's moving much more quickly. And so to your point, we have the potential to actually have more and more cases than we had in January and February, and we don't have the same kind of mask mandates in place and those kind of things. So we would encourage people to, go back to masking your communities. We see schools doing that. We see local governments doing that. Try to get us through this wave. We talked about flattening the curve early in the pandemic. We're really in the same place we are now. So all precautions are necessary again.
Yeah, trying to flatten that curve one more time. Dr. David Priest, thank you for everything you're doing and for joining us this morning. We appreciate it.
Thank you.